So basically, I want to talk about the fact that, we had to turn on a dime. You heard a lot about what was being done at Mount Sinai, so from a research perspective. But, basically March 11th was the benchmark of our system changing rapidly over a period of days. And within a period of weeks, we had to convert our existing service lines into basically COVID hospitals. We have a system and they were all COVID hospitals. And staff were not only reassigned to units, but their basic communities were disrupted because they were taken away from their teams, and they were also asked to do things they would never had to do before. Mortality rate was so high that in one of our hospitals, by the end of March, they had hit the yearly rate of deaths in 2019. Visitation was not permitted, so patients were isolated. And as was mentioned before, we didn't know, proning was even thought about. We didn't know what medications to use. And the fear of infection on the part of the workers was very high. Just to show you, this is actually the atrium of our hospital. This is where Starbucks is. This was converted into a nursing unit, and pods were built over the course of 7 days to accommodate what was thought to be overflow of patients. And this hospital has 1,100 beds. This shows actually what it looked like for patients. Everything was done actually to minimize contact between the healthcare workers and the patient for fear of infection, so that the work was done outside of the room. And healthcare workers also then had to become the conduit, if you will, between the patient and their family, since no family was allowed. And our buildings looks different. These holes are inpatient rooms for negative pressure rooms for folks on ventilation. So, we live in a hospital and medical school where both the dean, and the CEO are psychiatrists. And you heard a lot about Dennis Charner and his work on trauma and resilience. So in the period of basically 5 work days, a multidisciplinary task force was set up for the immediate response. And that included several departments, which I'll talk about in a bit. And we actually initiated a proactive outreach to highest need employees, which were pretty much everywhere. But the emergency departments and the ICUs were particularly hard hit. And also mental health liaisons were deployed to these areas to walk around to get a pulse of what was going on. In addition, everything was virtual, but different psychosocial support was provided for employees, including groups, individual counseling, guided self-care activities, and these wonderful recharge rooms were developed in the clinical areas where folks worked, where they could actually take a time to take a break. And we are a system of 42,000 employees. And one of the hardest things was actually how to get people to know where to go to get resources. And that took a lot of collaboration with the Office of Wellbeing and Resilience under John Ripp, Department of Psychiatry, Social Work, and Employee Assistance. You heard about the expected stress-related conditions. I do want to talk about one thing here. I'm not talking much about moral injury, but that's something that in our clinical practice, we're hearing more about how folks really are feeling that they could have done something different, and moral injury can lead to stress-related conditions. And of course, the issue of burnout has to be considered as well. So this study actually is the study that was done at Mount Sinai by John Ripp and his group to look at what happened to our healthcare workers. And the results are exactly what you saw for other places, but this was very close and personal for us, that this was done. The survey was sent out to over 6,000 folks, and a pretty good response rate of 55.8%. And the sample analyzed was 2,579. And what was found was that 39% of healthcare workers did screen in for either a mood disorder, major depression, an anxiety disorder, or a post-traumatic stress disorder. I'm only showing this slide, which actually was developed by SAMHSA to understand the fact that this is not something that comes and goes. There was a lot of heroic behavior, and a lot of the healthcare workers, by the way, did not like being called heroes, just for you to know. So it was commonly used, but not necessarily well received. The problem is that there are multiple ways of the pandemic. There are multiple other things going on in addition, to COVID-19, and we clearly are in this disillusionment phase. We're trying very hard to address it. But this is not an acute response to an acute situation. It has to be an ongoing response. So toward that end, it was decided actually in April that a center had to be developed that could manage long-term the issues related to the situation for our healthcare workers. And fortunately, there was a lot of experiences you've already heard, in trauma and resilience and program development. And here, the issue here is that there was 18 years of experience at Mount Sinai in the World Trade Center program for first responders. And in addition, and actually 3 of the 4 of us who really started the center, Dr. Katz, Dr. Piero, and Dr. Sharma, were involved, if not led, actually that program. And Dr. Katz actually had global experience in disaster psychiatry with tremendous leadership support, including from the board. And fortunately, we had a lot of relationships with other folks prior to doing this, which really facilitated kind of a rapid deployment of a center. We were basically asked to go live in June, and we started thinking about developing this in April. We had a lot of data to prove that there was a need, and we had philanthropy, which is very helpful. The challenge was that each hospital has its own culture. Coordination of efforts with multiple departments was an issue. Getting the word out to all stakeholders we knew would be an issue. The people were very busy. We had approval from Human Resources that people could take breaks to come and do workshops with us, but there was a shortage of staff. That was very hard, and that led to how we decided to have to deploy a center. We have 13 unions at Mount Sinai. We have multiple insurance coverages. It was the decision on senior leadership that we were not going to charge employees for the care. So we had to have a heavy lift with multiple carriers to get a no cost sharing done. And also there's the issue of getting over the stigma. So we developed the center. It is a centralized resource for all faculty and staff. Everybody in the health system has access to us. The goal was to develop resilience training workshops, develop an app, and focus on community engagement. And was decided very early on that we had to have our own treatment program, since in the psychiatry behavioral health clinics and their faculty practices were already 90% occupancy and getting a tremendous amount of need from the community that we serve. But this center at this time is only for folks who either work or learn, in our health system. The first thing that was done was actually Craig Katz took the chapters from the book that Dr. Charney and Southwick wrote and developed 10 workshops based upon the 10 factors. What we learned early on was that people were very interested in doing this, but people couldn't attend. It was very hard to get folks to come to so many workshops. So they were reduced down to 5 workshops. One is on faith, meaning, and spirituality. Another on social support and role models. Another, facing fears, active coping, self-care, and realistic optimism. And these basically are educational sessions where participants learn about the resilience factor. They learn how to actually adapt something and discuss creating a plan for themselves, which is actually being something that we're looking at now in an app that's being developed. And actually 99 workshops have now been conducted with a wide variety of healthcare workers. It does turn out that residents actually are more likely, or physicians, because they're more likely to be able to carve out time for didactics. But we are working with nursing, physician assistants, and other support staff. So this is the Wellness Hub mobile app. It was initially deployed, and thank you, Zahi, actually, to get us in contact with the Hazel-Plattner Institute for Digital Health. Because basically in a month, they built an app for us. And the app was actually first to be a confidential screening device with well-established scales regarding both issues of stress-related conditions, but also well-being and also spirituality. And the app now is on to more of a V3, if you will, where basically this is an example, the landing page. So one is learn about factors of resilience. The other one is journaling how one is doing, both related to resilience and day-to-day activities. My progress, and getting support. My progress, folks can log in to these different scales that assess either mood, anxiety, depression, and well-being, as I mentioned. And based upon their score, they immediately get a feedback. Green means you're doing well. Yellow means the cutoff score is above what we expected, and people then get prompts of ways that they can reach us or other folks for support. What now is in the app are actually videos about each of the factors of resilience. And this version of the app is focusing on actually now making this a resilience promoting opportunity for individuals to engage with. Each person who clicks in to Introduction to Resilience and one of the workshops we just talked about, they basically learn about it and then discuss it and then develop a plan of action. And based upon activities, they're now badges to support them. In addition, folks now have the ability, actually from the beginning, to get to know us immediately, call us, email us, and other activities that can help with them. My calmer activities could be yoga, it could be music, mental health support, and chaplaincy. The chaplains are very much integrated with this center, actually, in terms of rounding on staff. They're very well integrated into the clinical teams at Mount Sinai. So getting the word out. We adopted what's called the accelerator model for community-based participatory research, which has been done at our institute here in health equity and population health. The idea here was to get stakeholders who, from different disciplines and different hospitals, and hear what they think about what we're doing. And we meet on a monthly basis. They were the ones who actually said from the very beginning, you can't just do iOS, you have to have this in Android. Anything you do has to be bilingual. You can't just have flyers in English. They gave us very good ideas about how to get the word out, because a lot of the folks who work at Mount Sinai don't have easy access to a computer, and blast emails don't work. So we developed flyers, we developed 10 cards. We have staff who around in the hospitals. We have chocolate, thousands of chocolate bars, 10,000 coffee sleeves to get the word out with a QR code to get to us too. So clinical care. It is available for all staff, trainees, students, and faculty. And we have arranged at no cost sharing to participants that they have up to 14 visits with no out-of-pocket cost for them. There's, of course, pharmacotherapy, and we have trained social workers and psychologists, Dr. Piero, psychiatrist, Dr. Katz, who actually also perform cognitive behavioral therapy, interpersonal therapy. And we opened our doors to the center, as I said, June 20th. We opened the doors for the workshops July. We opened our clinical program in October. And as you can see, we started small, 31 visits in October. It doubled in November. It doubled again in January, and it keeps on growing. And actually, due to staff turnover and vacations, we don't have as large a size as we would think of patient visits. But the folks who are coming here are very symptomatic. 14% of suicidal ideation, for example. And we know we're only hitting the tip of the iceberg. We have over 1,000 visits and over 100 patients treated, but it's definitely people are suffering, and we hope we can get more folks to learn about us and come to us, and we're doing all that outreach toward that end. This could not have been accomplished without a lot of partnerships with Office of Wellbeing Resilience, Hazel Platinum Institute, Psychiatry, Human Resources, Population Health, Office of Diversity Inclusion, Nursing, Social Work, Support Services, GME, and Rehabilitation Department. I bring it up because in order to get something like this going, you need so much help from so many folks, and we were lucky actually, to get that help. This is who we are. As I mentioned, Dr. Sharma, DePiero, and Katz are all psychiatrists who all worked in World Trade Center or ran the program here. We have a chaplain who does our community engagement. We have a staff psychiatrist, Dr. Vivalakba, program manager, our social workers, another chaplain, and administrative support. So with that, I thank you all, and I'm sorry about the screen share being the way it is. I hope I got the point across.
All right, Deborah, you definitely did. I think it worked out fine. So thanks very much. And, this is a great initiative, and you've brought it to fruition very quickly. I mean, it's really, really going very well with lots of, people actually getting help, and the numbers are growing as we speak almost. So there is a question from Jill Barron. I mean, you want to pick that up? And there's another question. So Deb, if you just read them out and answer them, please.
Is the wellness app available for purchase for non-Mount Sinai employees? If so, what's its name? Thank you. It's not available for purchase. Actually, it's all employees can download it for free from a central repository here. It's anonymous, but right now it's an inward-facing app. But thank you. We plan on it being an outward-facing app, but we actually are embarking on a randomized controlled trial to see how it does work actually promoting resilience. It's called the Wellness Hub. The next question, what's the name of the app? It's called the Wellness Hub app.
All right. Yeah. I mean, it would be nice though if people will follow this lead, right? If we get other people who actually are interested either to purchase or to use it for free or whatever. You think that's going to be happening in the foreseeable future? We're going to make this available.
There are a lot of apps out there that purport, to do a lot of things, but there's no data to prove that they do what they say they're going to do. So we're being very cautious and methodical. And James Murrow, by the way, thank you for helping us a lot. I just said that you're ready. He's mentoring us on a lot of these things. We really want to test whether or not this app really does promote resilience. And I think that I think it's a very necessary mandatory step before we start vending it anywhere.
Yeah, that's a very good point. One more question by Eddie Golden.
Wellness Hub new version will be available to Mount Sinai by Science Central. Thank you, Eddie. Yes, Eddie's amazing. She and her team actually developed this app for us. Remarkable.
All right, great. Okay, thank you very much, Deb. That was great. If there are other questions, there are actually two other issues. You want to pick those up?
Cynthia Green. Hi, Cynthia. There are other populations similar in need of clinical assessment and resilience training that would benefit from this app, such as those in senior living. Will be interesting for comparison purposes too. There's no question that we have talked about, and there is a great app actually Dr. Hurton was involved in developing for folks with actually irritable bowel disease. So one way is to think about tailoring the app based upon the population that it may serve, be it a chronic illness, be it certain folks who are vulnerable. So there's no question something like that would be very useful. Matthew Dobbs, terrific resources and outreach initiatives. Did any patient needs arise as you developed the Wellness Hub that you didn't initially expect to surprise you? In terms of the app use, I think that it's not a treatment tool. It's just an assessment tool at this point resilience promoting. I think the real issue is, what do we find with the folks who we treated? And what we found was that the whole era of we're going through now is so stressful that it's not just about treating COVID-19 patients, but that we're hearing just a lot of stress and anxiety in general on our healthcare workers.
Okay, and then the final one is a thank you, which is great, and which is, I think, a great way to end.